Italy, the epicenter of Europe's coronavirus crisis, has taken the unprecedented step of locking down the entire country. It is a home to more than 60 million people. This is a bid to control the spread of the epidemic. Coronavirus sweeps through Italy at an unprecedented rate. The government extended a travel ban from Lombardy to the entire country in a drastic bid to halt the coronavirus outbreak. Residents of several northern regions, including Lombardy, the most populous region in the country, and Veneto, the fifth most populous, have been advised to isolate themselves as much as possible. Prime Minister Giuseppe Conte said as he announced the measures. There won't be just a red zone. We want to guarantee the health of our citizens. We understand that these measures will impose sacrifices. Sometimes small and sometimes very big. We are facing an emergency, a national emergency. We have to limit the spread of the virus and prevent our hospitals from being overwhelmed. There were cases of the COVID-19 virus identified in Lombardy, where Fashion Week was being held in Milan. Italians moving around must sign a form self-certifying that they are traveling for proven work needs. Anyone caught making a false declaration faces a sentence of up to 3 months in jail or a fine. Public gatherings are forbidden. Shopping malls need to be shut down over the weekends. Grocery shops and pharmacies are the only exception to the closure rules. Schools are closed. During this lockdown, museums, theaters, and swimming pools throughout the country will be shut down. Weddings and funerals have been suspended. Holiday has been cancelled for all healthcare workers. Bars and restaurants must ensure that patrons stay at least 1 meter apart or they too will be forced to close. One patient died, then another, and as concerns grew so, too, did the virus's reach, spreading east to the Veneto region. There were cases reported down in Sicily, off the toe of the Italian boot. The virus had traveled nearly 1,000 miles in 5 days. Italian doctors celebrated one small victory after the first patient diagnosed with the illness. A 38-year-old Unilever worker was moved out of intensive care and began breathing on his own. But the virus' rapid spread was forcing them to operate like wartime medics. They are triaging patients to decide who get access to scarce ICU beds. Unfortunately, we're only at the beginning, said Dr. Massimo Galli, head of infectious disease at Milan's Sacco Hospital. Dr. Elisabetta Grappelli is a virologist and lecturer in global health at St. George's University of London. She said isolation measures had a massive impact in fighting the disease that came from China. The virus can be killed with soap and slowed down by isolation, she said. We should remember how much we can do. We need to think beyond ourselves and our individual situations. She added, for the past 2 generations we have been lucky to go about our lives as we want. And this outbreak is a reminder that occasionally it will happen again. We need to make changes to the way we live and think as a society rather than as individuals. Thank you so much for watching. Don't forget to share this video and subscribe to our channel. Please click the subscribe button below and click the bell icon to be notified whenever we publish a new video.